Welcome to the Common Health Topics series by Pharma Education. This series is designed to help healthcare professionals improve their medical English skills by exploring key health conditions. Let's learn together and enhance your medical communication skills. In today's episode, we'll be discussing upper respiratory tract infection, URTI. We'll explore its causes, symptoms, treatment options, and patient advice to help you effectively communicate with patients about this condition. Description: upper respiratory tract infection is an infection that affects the upper parts of the respiratory system, including the nose, sinuses, throat, and larynx. It is one of the most common medical conditions and is usually caused by viruses, but can also be caused by bacteria. Common cold, pharyngitis, sinusitis, and laryngitis are all types of URTI. Most cases of URTI are not serious and resolve on their own within a few days to a week. Main symptoms: cough. Patients may experience a dry or productive cough, particularly at night or early in the morning. Sore throat. Pharyngitis or a burning sensation when swallowing is a common symptom of URTI. Runny or blocked nose. Patients often experience a runny nose, nasal congestion, or frequent sneezing. Mild fever. The infection may cause a mild fever, typically below 38.5 degrees Celsius. Headache or body aches. Patients may experience headaches or body aches, especially in cases of the common cold or sinusitis. Hoarseness. Laryngitis can cause a loss of voice or a hoarse-sounding voice. Fatigue. Patients may feel tired and lack energy throughout the course of the infection. Causes and risk factors. Viral infection. Viruses are the most common cause of URTI, including the common cold, rhinovirus, influenza, flu, and parainfluenza viruses. Bacterial infection. In some cases, bacteria such as Streptococcus pyogenes can cause pharyngitis or acute sinusitis. Weather factors. URTI are more common in winter or cold weather, when the immune system may be weaker. Crowded environments. URTI are more easily spread in crowded places like schools, offices, or public transport. Weakened immune system. Individuals with weakened immune systems, such as young children, the elderly, or those with chronic illnesses, are at higher risk for URTI. Treatment options. Rest and hydration. Getting adequate rest and drinking plenty of fluids helps the body recover more quickly and prevents dehydration from fever or nasal congestion. Pain relievers and fever reducers. Medications such as acetaminophen or ibuprofen can be used to alleviate headaches, sore throats, and reduce fever. Cough suppressants and decongestants. Cough medications or nasal decongestants can help relieve symptoms of a blocked nose and dry cough. Antibiotics only for bacterial infections. In cases of bacterial infections, streptococcal pharyngitis, or severe sinusitis, a doctor may prescribe antibiotics. Saltwater gargles. Gargling with warm salt water can help soothe a sore throat and reduce inflammation. Saline nasal sprays. Saline nasal sprays help clear nasal passages, reduce congestion, and prevent sinus infections. Patient advice: wash hands frequently. Washing hands with soap or using alcohol-based hand sanitizer helps prevent the spread of viruses and bacteria. Wear a mask. When you have URTI, wearing a mask helps prevent spreading the infection to others, especially when coughing or sneezing. Stay home, rest at home, and avoid contact with others until symptoms resolve to reduce the risk of spreading the infection. Stay hydrated. Drink plenty of fluids to keep the throat moist and thin nasal secretions, helping to reduce congestion and coughing. Avoid smoking and secondhand smoke. Smoking and exposure to smoke can worsen symptoms and prolong recovery.
Welcome to the Common Health Topics series by Pharma Education. This series is designed to help healthcare professionals improve their medical English skills by exploring key health conditions. Let's learn together and enhance your medical communication skills. In today's episode, we'll be discussing tinnitus. We'll explore its causes, symptoms, treatment options, and patient advice to help you effectively communicate with patients about this condition. Description: tinnitus is the perception of noise or ringing in the ears when there is no external sound. The noise may be buzzing, whistling, roaring, or hissing, and can occur in one or both ears, either continuously or intermittently. Tinnitus is not a disease, but a symptom of an underlying issue, such as age-related hearing loss, exposure to loud noise, or circulatory disorders. In some cases, tinnitus is temporary, but it can also be chronic. Main symptoms: noise in the ears. Patients may hear constant ringing or buzzing in their ears, even in quiet environments. Varying sound intensity. The tinnitus sound may vary in intensity, from mild to severe, and can disrupt daily activities. Ear discomfort. In some cases, tinnitus may be accompanied by a sensation of pain or discomfort in the ear. Hearing loss. Tinnitus is often associated with hearing loss, especially after exposure to loud noise or ear trauma. Dizziness or balance issues. Some patients may experience dizziness or balance problems alongside tinnitus. Causes and risk factors. Age-related hearing loss. As people age, their hearing ability gradually declines, leading to damage of the inner ear hair cells, which can cause tinnitus. Exposure to loud noise. Working in noisy environments or listening to loud sounds for extended periods can damage the inner ear and result in tinnitus. Earwax buildup. Excessive earwax can block the ear canal and create pressure, leading to tinnitus. Head or neck injuries. Trauma to the head or neck can affect the auditory nerves, causing tinnitus. Circulatory problems. Conditions like high blood pressure or atherosclerosis can cause irregular blood flow, leading to noises in the ear. Medications. Certain medications, such as antibiotics, diuretics, or antidepressants, can cause or worsen tinnitus. Treatment options. Treating the underlying cause. If tinnitus is caused by a treatable condition, such as earwax blockage or circulatory problems, addressing the root cause may alleviate symptoms. Hearing aids. If tinnitus is associated with hearing loss, using hearing aids can improve hearing and reduce the perception of tinnitus. Cognitive behavioral therapy, CBT. CBT is a psychological therapy that helps patients manage tinnitus and reduce the distress or anxiety associated with the condition. Sound therapy devices. Devices that produce soothing sounds, such as rain or wind noises, can help mask tinnitus and make it easier for patients to sleep. Medications. In some cases, doctors may prescribe sedatives, antidepressants, or antihistamines to relieve tinnitus symptoms and help patients feel more comfortable. Patient advice. Avoid loud noise. Wear earplugs or noise-canceling headphones when exposed to loud sounds to protect your ears and prevent further damage. Manage stress. Stress can worsen tinnitus, so practicing stress-reducing activities such as yoga, meditation, or deep breathing exercises can help. Regular health checkups. Visit your doctor regularly to monitor and treat underlying conditions such as high blood pressure, circulatory disorders, or ear problems. Limit the use of tinnitus-inducing medications. If medications are causing tinnitus, consult your doctor about adjusting the dosage or switching to a different drug. Keep ears clean. Maintain proper ear hygiene to prevent earwax buildup, but avoid using sharp objects to clean the ears, as this can damage the inner ear.
Welcome to the Common Health Topics series by AVN Pharma Education. This series is designed to help healthcare professionals improve their medical English skills by exploring key health conditions. Let's learn together and enhance your medical communication skills. In today's episode, we'll be discussing otitis media. We'll explore its causes, symptoms, treatment options, and patient advice to help you effectively communicate with patients about this condition. Description: Otitis media is inflammation or infection that occurs in the middle ear, the air-filled space behind the eardrum. This condition is common in children, but can also affect adults. Otitis media is typically caused by bacteria or viruses, especially following a cold, sore throat, or upper respiratory tract infection. If left untreated, otitis media can lead to temporary or permanent hearing loss and more serious complications. Main symptoms: ear pain. Patients may experience a dull or sharp pain in the ear, which often worsens when lying down or swallowing. Hearing loss. Inflammation and fluid buildup in the middle ear can cause temporary hearing loss, leading to a sensation of ear fullness or muffled sounds. Ear discharge. In some cases, yellow or white pus may drain from the ear if the eardrum ruptures. Fever. Otitis media often causes a fever, especially in young children, with a temperature usually above 38 degrees Celsius, 100.4 degrees Fahrenheit. Irritability. Children may become irritable, cry more frequently, and may pull or rub their ears when experiencing otitis media. Dizziness or balance problems. Otitis media can affect a person's sense of balance, causing dizziness or problems with coordination. Causes and risk factors. Upper respiratory infections. Otitis media often develops after a cold, sore throat, or other upper respiratory infections. Age factor. Young children have shorter and narrower eustachian tubes, making them more prone to blockages and ear infections. Environmental factors. Exposure to cigarette smoke or living in polluted environments can increase the risk of otitis media. Allergies. Individuals with allergies are at higher risk of otitis media due to blockages and inflammation in the upper respiratory tract. Family history. If there is a family history of otitis media, the risk of developing the condition is higher. Treatment options. Watchful waiting. In many cases, otitis media resolves on its own without specific treatment, especially if caused by a virus. Doctors may recommend waiting for 48 to 72 hours to see if symptoms improve. Pain relievers. Pain relievers such as acetaminophen or ibuprofen can be used to alleviate pain and reduce fever. Antibiotics. If otitis media is caused by bacteria, or if symptoms do not improve after a few days, a doctor may prescribe antibiotics, such as amoxicillin. Ear drainage. In severe or recurrent cases, doctors may perform a procedure to insert a drainage tube into the eardrum to help drain fluid from the middle ear and prevent future infections. Eardrops. Eardrops can provide temporary relief from pain and inflammation, especially if the eardrum has ruptured. Patient advice. Avoid smoking. Stay away from cigarette smoke and other irritants to reduce the risk of otitis media and respiratory infections. Practice good hand hygiene. Washing hands frequently helps prevent the spread of bacteria and viruses, reducing the risk of otitis media. Use antibiotics as prescribed. If antibiotics are prescribed, complete the full course and do not stop early, even if symptoms improve. See a doctor if symptoms persist. If otitis media symptoms do not improve after a few days, or if there are signs of more serious complications, such as hearing loss or ear discharge, seek medical attention.
Welcome to the Common Health Topics series by VІωρ Pharma Education. This series is designed to help healthcare professionals improve their medical English skills by exploring key health conditions. Let's learn together and enhance your medical communication skills. In today's episode, we'll be discussing allergic rhinitis. We'll explore its causes, symptoms, treatment options, and patient advice to help you effectively communicate with patients about this condition. Description: Allergic rhinitis is the inflammation of the nasal mucosa caused by an allergic reaction to airborne allergens such as pollen, dust, mold, or pet dander. When the body reacts to these allergens, the immune system releases histamine and other chemicals, leading to typical symptoms like sneezing, nasal congestion, and runny nose. Allergic rhinitis can be seasonal, commonly referred to as hay fever, or occur year-round if the patient is continuously exposed to allergens. Main symptoms: Frequent sneezing. Repeated sneezing, especially in the morning or when exposed to allergens. Nasal congestion. Patients may experience blocked nasal passages, making it difficult to breathe through the nose. Runny nose. Clear nasal discharge is common when exposed to allergens. Itchy eyes, nose, and throat. Itching in the eyes, nose, throat, or ears is a characteristic symptom of allergic rhinitis. Watery eyes. The eyes may become red, itchy, and watery due to accompanying allergic conjunctivitis. Cough and sore throat. Postnasal drip can lead to coughing and a sore throat. Fatigue. Prolonged allergic rhinitis can cause fatigue and reduce quality of life. Causes and risk factors. Airborne allergens. Pollen, dust mites, mold, pet dander, and dust are common allergens that trigger allergic rhinitis. Genetics. If parents or close relatives have allergic rhinitis or other allergic conditions, the risk of developing the condition is higher. Weather. Allergic rhinitis symptoms may worsen during spring and fall when pollen counts are higher in the air. Indoor allergens. Frequent exposure to dust, pet dander, or mold indoors can cause year-round allergic rhinitis. Cigarette smoke. Exposure to cigarette smoke can irritate the nasal mucosa and increase the risk of allergic rhinitis. Treatment options. Antihistamines. Oral or nasal antihistamines help reduce symptoms such as itching, sneezing, and runny nose by blocking the effects of histamine. Nasal corticosteroid sprays. These anti-inflammatory sprays reduce swelling in the nasal passages and prevent allergic rhinitis symptoms. Decongestants. Decongestants can help relieve nasal congestion by shrinking blood vessels in the nasal passages, but they should not be used long-term due to the risk of dependency. Immunotherapy. In severe or persistent cases, immunotherapy may be used to desensitize the body to allergens through allergen injections or sublingual tablets. Saline nasal irrigation. Rinsing the nasal passages with saline solution helps clear allergens and reduce nasal congestion. Patient advice. Avoid allergens. Limit exposure to allergens like pollen, dust, and pet dander by using air purifiers, keeping windows closed during pollen season, and maintaining a clean home. Clean nasal passages daily. Use saline nasal irrigation daily to clear allergens and reduce nasal congestion. Wear a mask. Wear a mask when going outside during pollen season or while cleaning to avoid exposure to allergens. Change air filters and clean home. Use air purifiers and regularly change air filters to keep indoor air clean and reduce exposure to allergens. Avoid cigarette smoke. Stay away from environments with cigarette smoke as it can worsen allergic rhinitis symptoms.
Welcome to the Common Health Topics series by AVN Pharma Education. This series is designed to help healthcare professionals improve their medical English skills by exploring key health conditions. Let's learn together and enhance your medical communication skills. In today's episode, we'll be discussing sinusitis. We'll explore its causes, symptoms, treatment options, and patient advice to help you effectively communicate with patients about this condition. Description. Sinusitis is inflammation or infection of the sinus's hollow cavities in the facial bones, located near the nose. The sinuses become inflamed and swollen, obstructing the drainage of mucus, leading to congestion, pain, and discomfort. Sinusitis can be acute, lasting less than 4 weeks, or chronic, lasting more than 12 weeks. Causes of sinusitis include viral or bacterial infections, allergies, or structural problems in the nose. Main symptoms: facial pain or pressure. Patients often feel pain or pressure in the sinuses, especially around the forehead, cheeks, or eyes. Nasal congestion. Patients experience difficulty breathing through the nose due to mucus blockage in the sinuses. Runny nose. Mucus may drain out through the nose or down the back of the throat. Postnasal drip. Often yellow or green in color. Cough or sore throat. Postnasal drip can irritate the throat, leading to coughing, especially at night. Headache. Sinusitis may cause severe headaches, particularly when bending over or performing movements that increase sinus pressure. Fever. In some cases of sinus infection, patients may experience fever, fatigue, and weakness. Causes and risk factors. Viral or bacterial infection. Colds or upper respiratory infections can block the sinuses, allowing bacteria to grow and cause inflammation. Allergies. Allergies to pollen, dust, or pet dander can cause swelling of the nasal and sinus linings, leading to allergic sinusitis. Nasal polyps. Nasal polyps are soft tissue growths in the nose and sinuses that can obstruct drainage and lead to sinusitis. Abnormal nasal structures. Structural issues like a deviated septum can block sinus drainage and lead to chronic sinusitis. Underlying conditions. Individuals with immune system disorders, such as HIV, AIDS, or autoimmune diseases, are at higher risk of sinusitis due to weakened immunity. Treatment options. Pain relievers and fever reducers. Medications like acetaminophen or ibuprofen help relieve pain and reduce fever caused by sinusitis. Decongestants. Oral or nasal decongestants help shrink blood vessels in the nasal lining, reducing congestion and clearing the sinuses. Antibiotics, if bacterial. If sinusitis is caused by a bacterial infection, doctors may prescribe antibiotics to eliminate the bacteria and prevent the infection from spreading. Nasal corticosteroid sprays. These sprays reduce inflammation and swelling in the sinus linings, helping to clear the sinuses. Saline sinus rinse. Daily rinsing of the sinuses with saline solution helps clear mucus and reduce inflammation. Surgery in severe cases. In cases of chronic sinusitis or nasal polyps, sinus surgery may be considered to enlarge the sinuses and improve drainage. Patient advice. Maintain nasal hygiene. Daily nasal irrigation with saline solution helps remove allergens and mucus, reducing the risk of recurrent sinusitis. Stay hydrated. Drinking plenty of water helps thin the mucus and clear the sinuses. Use a humidifier. Using a humidifier at home keeps the air moist, preventing nasal dryness and reducing the risk of sinusitis. Avoid allergens. If you have allergic sinusitis, limit exposure to allergens such as pollen, dust, and pet dander. See a doctor if symptoms persist. If sinusitis symptoms last longer than 10 days or worsen with high fever or severe headaches, consult a doctor.
Welcome to the Common Health Topics series by Pharma Education. This series is designed to help healthcare professionals improve their medical English skills by exploring key health conditions. Let's learn together and enhance your medical communication skills. In today's episode, we'll be discussing pharyngitis. We'll explore its causes, symptoms, treatment options, and patient advice to help you effectively communicate with patients about this condition. Description. Pharyngitis, commonly known as a sore throat, is inflammation of the pharyngeal mucosa, causing pain, irritation, and discomfort when swallowing. Pharyngitis is often caused by viruses, bacteria, or irritants such as cigarette smoke and air pollution. It is common and usually resolves on its own within a few days, but more severe cases, especially those caused by bacteria like Streptococcus, may require treatment. Main symptoms. Sore throat, a sensation of pain or irritation in the throat, especially when swallowing or speaking. Difficulty swallowing. Patients may experience pain or discomfort when swallowing food, drinks, or even saliva. Redness and swelling. The back of the throat may appear red and swollen. Hoarseness. Pharyngitis can affect the vocal cords, causing hoarseness or a loss of voice. Fever. In cases of infectious pharyngitis, patients may develop a low to high-grade fever. Coughing and sneezing. Symptoms like coughing or sneezing often accompany viral pharyngitis, such as the common cold. Causes and risk factors. Viral infections. Viruses are the most common cause of pharyngitis, including cold viruses, influenza, and Epstein-Barr virus, causing mononucleosis. Bacterial infections. Bacterial pharyngitis, such as Groupa streptococcus, causing strep throat, requires antibiotic treatment. Allergies. Pharyngitis can occur when patients are exposed to allergens such as pollen, pet dander, or dust. Environmental irritants. Cigarette smoke, air pollution, or inhaling chemicals can irritate the throat lining and lead to pharyngitis. Dry throat. Breathing through the mouth or living in a dry environment can dry out the throat lining, increasing the risk of pharyngitis. Treatment options. Rest and hydration. Resting and drinking plenty of fluids helps soothe the throat and aid in quicker recovery. Pain relievers and fever reducers. Medications like acetaminophen or ibuprofen help alleviate throat pain and reduce fever. Throat sprays or lozenges. Sprays or lozenges containing local anesthetics help soothe the throat and reduce pain. Antibiotics, if bacterial. If caused by Streptococcus bacteria, doctors may prescribe antibiotics to treat the infection and prevent complications. Saltwater gargles. Gargling with warm salt water can reduce inflammation and soothe the throat. Patient advice. Avoid smoking. Cigarette smoke can irritate the throat and worsen pharyngitis symptoms. Avoid smoking or exposure to secondhand smoke. Practice good hand hygiene. Wash hands frequently to prevent the spread of bacteria and viruses that cause pharyngitis. Use a humidifier. Using a humidifier at home helps keep the air moist and reduces dry throat symptoms, especially during winter. Avoid irritants. Limit exposure to irritants such as chemicals, smoke, or dust to prevent worsening pharyngitis. Stay hydrated. Drinking plenty of water helps soothe the throat, prevent dehydration, and flush out viruses or bacteria.
Welcome to the Common Health Topics series by AVN Pharma Education. This series is designed to help healthcare professionals improve their medical English skills by exploring key health conditions. Let's learn together and enhance your medical communication skills. In today's episode, we'll be discussing toothache. We'll explore its causes, symptoms, treatment options, and patient advice to help you effectively communicate with patients about this condition. Description. Toothache is the pain or discomfort in one or more teeth, typically caused by tooth decay, gum disease, infection, or nerve damage. It can come on suddenly or develop gradually, and the pain may range from mild to severe. Toothache often worsens when eating, especially with exposure to hot, cold, or sweet foods. If left untreated, it can lead to serious infections or tooth loss. Main symptoms. Sharp or constant pain. The pain may appear suddenly or persist for an extended period. Sensitivity to temperature. Toothache often worsens when exposed to hot or cold foods and drinks. Pain when biting or chewing. The affected tooth may cause pain when biting or chewing food. Swelling or inflammation. The area around the tooth may become swollen, and the gums may be red and inflamed. Bad breath or strange taste. Toothache caused by infection may be accompanied by bad breath or a foul taste in the mouth. Causes and risk factors. Tooth decay, the most common cause of toothache, occurring when tooth enamel is destroyed by acid from bacteria. Gum disease, gingivitis or periodontitis can cause pain and inflammation around the teeth. Tooth infection, infection at the tooth root or an abscess can cause severe pain and requires immediate treatment. Tooth injury, cracked teeth, broken enamel, or nerve damage can lead to prolonged tooth pain. Wisdom teeth eruption. Impacted or improperly positioned wisdom teeth can cause pain and inflammation in the surrounding gums. Treatment options. Pain relievers. Over-the-counter pain relievers like ibuprofen or acetaminophen can provide temporary relief from tooth pain. Cold compress. Applying a cold pack to the outside of the cheek can help reduce swelling and pain. Saltwater rinse. Rinsing with warm salt water can reduce inflammation and cleanse the affected area. Dental treatment. A dentist may recommend fillings, root canal therapy, or tooth extraction depending on the cause of the toothache. Patient advice. Maintain oral hygiene. Brush your teeth at least twice a day and use dental floss to remove plaque and bacteria. Avoid irritating foods. Steer clear of foods that are too hot, cold, or sweet, as they can exacerbate the pain. See a dentist. If the pain persists for more than a few days, consult a dentist for proper diagnosis and treatment. Thanks for watching. Like and subscribe to catch our next topic in the Common Health Topics series. See you soon.
AVN Pharma Education.